Hi there, this is Dr. Ross Miller, a consulting dentist with Sonitus Medical, and in this presentation I'll be talking about dental records requirements for the SoundBite hearing system. First, I would like to talk a little bit about the FDA indications, dental publications, and then talk about the requirements for dental records, the impression and the reason why we do the impression a certain way, the impression technique, model, and then summarize. FDA indications for use. The SoundBite prosthetic device is intended for the following types of patients. Patients who are 18 years of older, have moderately severe, or profound sensorineural hearing loss in one ear and normal hearing in the other. This is defined as basically single-sided deafness, and it can be abbreviated SSD. And it's also has a clear FDA clearance for conductive hearing loss. Additional use of SoundBite is intended for patients with at least 2 contiguous molars or premolars with no untreated tooth decay. Patients with tooth decay present are to first have the restorations taken care of before being fit for SoundBite. I mean, basically pretty common sense stuff. We want that any dental decay in the teeth that the abutment's going to be for the SoundBite to be taken care of. Healthy attachment to those teeth with no pockets greater than 5 millimeters, no mobile teeth, and no significant bone loss. That is, bone loss greater than 34% on the mesial and distal. We have had a number of publications over the last 2 years. We had a news article in the August 15, 2011 ADA News. We've done a safety of an intraoral hearing device utilizing split mouth research design that was done in the International Journal of Clinical Dentistry, and then also in the American Journal of Orthodontics and Dentofacial Orthopedics. We did a publication in 2010 on the SoundBite hearing system. So what are the requirements for the dental records? From a global perspective, we require an upper dental model made using alginate impression material on the side of the ITM to be worn. Now we use a quadrant tray, but you can just as easily use a full arch if that's what you prefer. The dental model must accurately capture the tooth and soft tissue anatomy in the area on which the ITM is to be worn. And the ITM stands for in the mouth component of the SoundBite system. There's one on the ear, which is the BTE, but the one that we're primarily focused on this presentation is the ITM in the mouth. A lower model is required as well if the lower tooth is distal to the upper tooth. That is, if the lower teeth, if it's sort of a class 2 situation in dental terms, the lower teeth are behind the upper teeth, or if you just don't have any space behind the upper teeth, and I'll get a little bit more in depth on that, you'd probably want to get a lower arch. A quadrant upper dental model of the other side or full arch is also required if there's a dental condition, medical condition, or patient preference present to suggest the ITM may be suitably worn on the other side. So, for example, I've had a patient at one office where they had a 7-unit bridge on one side and a natural dentition on the other. Well, you probably want to take the impression on the side of the natural dentition, not the 7-unit bridge. Stone models, dental stone or plaster. We do have our preferences, and I'll talk about that a little bit later. But the preference is white model stone, but it can be just about anything. Do not require x-rays at this time. Sonitus is dependent on the dentist to make certain that the teeth are healthy. Photos are occasionally helpful, but not required. Please don't send dental impressions, only poured up models, and please do not modify the models. We take the rough pour that comes out of your alginate impression. Ensure that the model includes accurate dental and soft tissue anatomy extending at least 2 to 3 millimeters to the midline of the palate, 2 to 3 millimeters past the gingiva of the buccal side, and 2 to 3 millimeters past the last molar of the distal side of the teeth. We want to get as close to the midline as we can on the side of the ITM, that is where the first and second molars are. Try to get as far to the palate. And I'll show you a way to do that. It's pretty easy to do. Pour up the stone within 24 hours or sooner. Actually, we would prefer that you do it as soon as you can. But some alginates say 24-hour, and that's what this is referring to. But if you can do it within the first 10 minutes of the impression, it's even better. Try not to send us PVS material, and I'll tell you why we really prefer alginate, and I think this presentation will show you that. Make sure it's accurate, because alginate captures soft tissue and hard tissue nicely, and alginate tends to push soft tissue out of the way. It's thicker. PVS is really great for minute detail around teeth, but it's not that great if you're trying to flow out over the palate or flow up in the vestibular areas to get the soft tissue out of the way. Please use metal tray that specified or provided by Sonitus Medical, and please do not send impressions. We really would rather you just send poured up models. The ITM is preferably worn on the side of the patient's better ear to minimize the distance between the ITM and the better cochlea. However, the ITM can be effectively worn on other side as well. So if there's some dental condition that requires it to be moved to the other side, that's okay. I mean, the dentist who's involved with SoundBite, you have the option to move it to the other side. Please also send a model of the other side if dental conditions such as excessive crowding, crossbite, or extensive past dental or medical conditions such as acoustic neuroma, numbness, or inability to chew on the non-ITM side suggest that the ITM may be worn better on the other side. So it's really there's a lot of the dentist is brought into these decisions because the teeth are so important in holding the ITM in a comfortable position. So please use your common sense in dictating where you want that ITM. Sonitus Medical will occasionally determine that the ITM side be switched to optimize the product performance. So sometimes we'll get models in at Sonitus Medical, and we would like you to take it on the other side, because sometimes it's just the anatomy of the teeth, a crossbite or something is going on that makes it near impossible for us to make it on the side that you take your impression on. So sometimes a full arch is perfectly acceptable, or 2 quadrant trays if you don't have any if you don't know which side to do it on. But more than likely, 80% of the time, you're going to find that just a quadrant tray on the side that is asked for by the audiologist would work just fine. So let's talk about that impression a little bit. I like to use Chromopam 100 using a Dux Alginator 2. You can get this from Pearson Dental. It spins down the alginate very nicely. And Chromopam is a great alginate. It changes colors as you mix it, as you put it in the mouth, and when it's done setting up. It's a nice material to use. The impression trays that we recommend right now at Sonitus Medical are these 99 swivel trays. You can get them through Co. And they swivel. You don't have to worry about having left or right in the office, and you can bend these to form to basically adapt to any upper arch quadrant. Here's some examples of impressions. Notice on the left here, you've got a lot of. I'm going to get my arrow involved here. Notice that we have a lot of dental information here. We're almost all the way. We're past the palate with a quadrant tray, and we're up into the vestibule here. This is a very nice impression. We're all the way around where we need to be. This impression over here isn't so good because we have to make some guesswork as to what's happening here. I mean, there could be a tori, there could be any number of things up here that keep us from getting our battery up into this area. So this isn't so good. We really want to focus more on this type of impression. Again, here the not so good impression. One reason I kind of moved away from taking full arches is because sometimes you get a really nice impression of one side and you get a kind of a knife edge on the other side. And so sometimes a full arch, one side interferes with the other when you're trying to get a good impression of the area that we call the SoundBite impression. Here's a nice shot of a SoundBite impression. A lot of times you'll find that when you take a very nice SoundBite impression, you get the upper and side, both incisors in there, and you get almost the whole palate, which is what we put a battery right here, and our device fits around here. So you really need all the buccal information, the distal, and toward the palate. All that information. We need to know if there's a tori up here, so that we can work around it. Here's some device. Here are some of our ITMs on CAS, quadrant CAS. And I'm going to read it one more time here. Is ensure that the model includes the accurate dental and soft tissue anatomy extending to within at least 2 to 3 millimeters of the midline of the palate. So if you can get to the palate, great. 2 to 3 millimeters past the gingiva on the buccal side, and 2 to 3 millimeters past the last molar on the distal side. Alginate again is the material of choice to be used with this, and PVS, we don't believe PVS is good for this impression due to its flow characteristics and the fact that you get a lot of knife edges. And please do not send impressions. When you're using your single tray, when you're using impression trays, use the one that we recommend, the Co 99. Don't use single crown impression trays. That's probably the most common mistake that dentists make. They may not be 100% engaged into what we're asking the office to do. They send it back to their dental staff, and we basically get a quadrant single crown impression, and that's really not what we're looking for. We're looking for a SoundBite impression, not a crown impression. So you need to the dentists involved with SoundBite need to understand all the areas that we need to be taking impressions of, so that we don't ask you to retake the impression. We really don't want to do that. Before taking the impression, take a look at the dental anatomy. Try in the tray, noting where the front edge of the tray is so you can duplicate that position when alginate is placed. Put excess alginate on the palate before taking the impression. Place the excess alginate on the lingual side of the impression tray also. Take the impression, making sure it's seated and not moving, and remove and pour up as soon as possible. If there is a dental condition, a medical or patient preference present that suggests the ITM may be more suitably worn on the other side, feel free to take the impression on the other side. There's no reason that the dentist can't make that call when you're with the patient and looking in their mouth. The ITM is preferably worn on the side with the patient's better ear to minimize the distance between the ITM and the better cochlea. However, if they don't have any teeth or there's a partial denture or something up there that mitigates that, please take an impression of the other side. If you need to, please send a model of the other side if dental conditions such as excessive crowding or crossbite or extensive past dental work, or medical conditions such as acoustic neuroma, numbness, or inability to chew on the non-ITM side suggest that the ITM may be better worn on the other side. Sonitus Medical will occasionally determine that the ITM side be switched to be optimized. So you need to question the patient about their past history. If they've had, if the acoustic neuroma has created numbness, or if there's a problem on the side of the surgery, then more than likely taking an impression of the other side would be more helpful. Let's talk about impression technique. Now, I put together some photos here on a model or a plastic Typodont, and just to kind of show you how the impression taking that we do here. But it's important to trial fit that tray first. And again, I use chromopan and an alginator to mix the alginate. And you can use whatever technique you want, whatever works with your patients. But I found that chromopan and the alginator work really good to get nice impressions around the back teeth for the SoundBite hearing system. Just a series of slides. I usually use 2 scoops. Chromopan comes with 2 little scoops in there, 2 plastic scoops, one for the alginate, one for the water. I put two scoops of alginate into my bowl, put 2 scoops of water in there, and then mix it up, spin it around. The nice thing about this, you can get a very nice flow characteristics, no bubbles, and you can see down on this slide here. Let me get my mouse going again. How smooth and nice that mixture is. You put it in the tray. I try to on the lingual. It's sort of opposite of what we do for trying to get the vestibule. Is you want to kind of increase the amount of alginate you have on the palatal side of that impression. And then I also mix a little extra, put it on the side, ready to put in the patient's mouth. So I take that extra alginate, put it on the palate. There it is there. Take that impression. You'll see that that's almost a full arch impression. Okay, it's not really a quadrant. It's a 3/4 full arch impression. It takes a very good impression of the side that we're interested in. Here you see the alginate ready to be poured up, and you can see how much information that we have around that tooth. Now this is an artifact from this fall off, this model here, but it can go all the way around. We're really interested in all this information around. I could have probably done better here, but we're really interested in this area around these teeth on the palate, backside of the molars, and then around the buccal segment here. We need to get good information. This is where our actuator is going to be, and this is where our battery is going to be. Some challenges that you might come across. Well, some patients have tori. We can work around those, but be aware that they're there. And if you need to, take a full arch, but you can also pick them up on your quadrants. But just be aware that they're there, and don't score them off the cast. Sometimes orthodontic issues, the ins and outs of teeth. Like on this particular case, maybe this side would be better because you've got sort of this weird angle here, and there's a wisdom tooth back there that adds to that. Also, unfinished dentistry. If you've got implants that people are working on, or dentists are working on, or spaces, try to pick the side that has the most teeth and most would help our ITM fit better. Then occlusion. Here's a side we got a crossbite and sort of a vague dental anatomy as to what's going on, but our ITM, if we're going to try to put it here, this tooth's going to hit it. And so this may not be the best side for an ITM. So look at the occlusion, and we'll get back into that a little bit in a second. So we put in this 0.61 inch wire. We call it the hypotube. There's actually electronics inside there that communicate between the battery and the actuator. It fits nicely in the back side, on the distal side of the last molar. But that's not always true. On some patients where the lower arch is farther back, you may find yourself hitting that hypotube. So in a case like this, you might want to take a lower impression. Okay, if those lower teeth are scooted back distally around those upper, into sort of a class 2 situation, you probably want to take an impression of the lower arch and the upper arch to send that in. Another situation that you might find is where you got a large operculum or soft tissue in the back of the upper second molar or wisdom tooth or what have you. If that soft tissue, it may be possible that you might want to do a surgical reduction of that soft tissue, or remove it before you take your impression. You could do it with an electrosurge or laser or what have you. But keep in mind that this might require a lower impression also. Some examples of some good models that we get out of these impressions. Notice that we have a significant amount of information on this quadrant tray regarding the palate. And of course, here's sort of a telltale sign. There's two incisors up here, so you can tell that you're going to get a lot of good information there. And notice around the distal, we've got, it's not a void. We can see exactly what we have back here, the crowns and the soft tissue. Over here we have some impressions that were taken from a PVS. Notice the knife edge, the PVS material, the light body doesn't flow up here, it doesn't flow over here under the palate. And so we have to do some guesswork here. And you notice here this cast has been scored, and that cast has been scored by us, by Sonitus. But we have to do some guesswork, and we don't know if there's a tori there, and that can be a problem for fit. So we really would rather you take alginate impressions and make sure you flow over toward that midline and get as much information as you can, so that we can make you a very nice fitting, make the patient a very nice fitting ITM. Some more impressions or models that we got. Great information on the palate all the way around. Notice how I can take a picture from the distal, and I see the attachments here. I can see the vestibule, and I can see the teeth. All those things are necessary for us to get in here and make a nice product. Again, here we have the same thing, and nice information here. Here's a impression that we got on with a PVS type impression. This is a good impression, but it's not going to help us get where we need to be on the palate. You can see right where we need information, we get lack of definition, and also this the telltale knife edge of the impression here. So this is not going to help us get where we need to be with the ITM. It gets great impressions of the edges of fillings and things, but we cannot know where that battery needs to go. And it doesn't flow into that soft tissue where we need to get it to in order for us to make our device. The model stone that we use actually internally is ETI Empire Direct. It's a product that you can get. It's made in the U.S. and we use the dental stone, the high strength dental stone, make it out of white. But it can be anything that you're using in the office, and it pours up nice full arches and quadrant arches. One thing that we don't want dentists to do is adjust the models and the stone. Don't let your staff take this to the grinding wheel, and don't let anybody adjust the palate, because there's a lot of times there's tori here and we can't see those things unless we have a impression of it and unless we have a model of it. And don't adjust the distal side of these, because we need this information for where the battery goes. Here's a schematic of our ITM, the actuator. This is what produces the sound, this little device here. This goes on the buccal. The actuator nub is actually what we want touching the teeth. That should only touch 2 teeth, usually the first and second molar, but it could be the bicuspid. The hypotube is a tube that runs between the buccal and lingual aspects of the ITM. And then we have this palatal acrylic that follows. This is sort of what you see analogously to our retainers that we have in dentistry, in orthodontics, partial dentures, that sort of thing. And then the battery, which is on this side, on the palate. So a little bit of history on why we take the impression we do. As components got smaller, the ITM became smaller, and so we've done extensive research on this. We want to make a single-sided ITM because it's much more comfortable than having something across the palate. We did have a ITM that looked like this at one point, and it's not that comfortable. So the size, shape, and electronics change. It's the only device that I'm aware of with a battery in the mouth, but it must avoid biting forces, dislodging forces, and provide good sound quality for it to work. And for us to be able to do that, we need a great impression from you guys out there that are taking impressions for your patients. And one of the nice things about it is it helps our patients avoid surgery. And don't think of one thing that we need to kind of get out there is that we take a SoundBite impression to pour up a SoundBite quadrant model or full arch model, but we need it's not a regular impression for a retainer or a crown or a denture or partial denture. It's a SoundBite quadrant impression or a SoundBite quadrant model is what we're looking for. Now let's talk a little bit about that lower impression. When might you need it? Well, when your occlusion is a little bit odd, or when you find yourself biting on the tube, the lower model might be very useful for us. If the lower tooth is distal to the upper tooth, the lower model is required. Because the ITM requires a large diameter wire to pass distal to the last tooth in the upper arch, a quadrant lower opposing arch made using an alginate impression on the side is required. If the lower tooth is mesial to the upper arch, a lower model is not required. So you really need to look in the mouth, take a look at your models that you're taking, and see what the occlusion looks like back there. Pretty much all of my patients I use quadrant impressions, but I've been doing this now. I've probably done 100 or so of these types of impressions. I've used full arch, but for a single-sided device, I think it's overkill. I think you can get a great impression doing a quadrant tray with this technique, and so that's why I continue doing it that way. In summary, this is a SoundBite impression. It's not a crown impression. It's not a partial denture impression. Identify potential problem areas before you take the impression. Take a look at their occlusion. Look in the patient's mouth. Take a look at the palate. Make sure there's no large tori there that you may not get an impression of. We got to have the impression of the tori and any occlusal factors that might make us make the device differently. Look for cross bites, high gingival distal to the upper teeth, and the posterior cross bite, which might require a lower impression. Pour up the model, but do not adjust the model, and pour up the model as soon as you can. Alginate tends to dehydrate right away and change its shape. So the sooner you pour it up, the better. All things being equal, take impression on the side of the best teeth. If uncertain, take 2 quadrants or a full arch. We do want to, in order for the patient to get better hearing, the ITM has to fit nicely. And if one side is missing teeth, or they have a large bridge or something that's going to make it almost impossible for an ITM to fit nicely, then by all means take an impression on the other side. And this is a great way for us to help our patients. It's something that we haven't had in dentistry for in dental history, so it's great to be able to help our patients with hearing better. And so have fun with this and enjoy treating your patients' hearing and being a part of that team that does that. So thank you for listening. I hope you found this helpful. We will be doing a number of these types of presentations on the web. A few more movies are coming out. And so this is Dr. Ross Miller saying good night, and hope you have a great day and have fun with your patients.